Hey everyone, this is Troy with Ohio Men's Health. Hey, today we're going to be talking about one of the most common things that I get questions for when I get new phone calls or when folks are on testosterone, or maybe you go on some forums and you're just doing some research and you kind of go, hey, I've got questions on this, and it's going to be in regards to peptide therapy, but most specific to Sermorelin. So today we're going to talk about Sermorelin, which has been a peptide that we've been using for well over 10 years in these practices. And it has considerable benefits, but it also has a time and a place. So Sermorelin is a growth hormone releasing peptide. So this will make us make more growth hormone essentially. So we're not giving growth hormone, but it's just making our body secrete more of it. Now the reasons that we'll often go to a medicine like this for guys that are on testosterone is when testosterone is helping, but we're still having some limitations in the benefits that we've seen from testosterone replacement therapy. Now, some of the things that really kind of cue me in to start looking into this are guys that are on testosterone replacement therapy and we're still having some sleep disturbance where our quality of sleep is just still poor. And we're just not getting that deep sleep, which can limit the ability for you to experience the energy that you're looking for when you come to practices like these and you're trying to optimize your energy levels, because that's one of the most common reasons that we see folks. And if we can't get you sleeping right, we are always going to be throwing more medicines at you. So sleep is a very important one to try to get right. So we've got to get sleep right, and a growth hormone releasing peptide like Sermorelin is wonderful for it. Now, another thing that we will use these peptides for is when we start getting these chronic joint aches and pains. For instance, I'm 51 years old. I'm still CrossFitting at 51 years old. I was 21 years Army, so my body's banged up. I got bad ankles, bad knees, bad lower back, and it's not that they're terrible, it's just that they hurt. And it really is a struggle, quite frankly, for me to get into the gym at times because it hurts. But I do it, but once I get warmed up, I'm good, but it hurts. So when I create injuries, which happens frequently with CrossFit, I do have some arthritis in my knees. When they become flared up, I will oftentimes cycle on to Sermorelin to really help with the joint aches and pains or recover from an acute injury or a chronic injury that's been exacerbated and is considerably worse. Now, the cool thing about Sermorelin is the synergistic effect that it has with testosterone replacement therapy. So it is synergistic in a lot of different ways. Number one, when utilized together with testosterone replacement therapy, it greatly enhances the body composition. These two work extremely well to increase our protein anabolism, so our protein production and our synthesis of protein synthesis is increased significantly. So with that, we have the ability to recover, to repair better from harder workouts, hard work outside. Like if you're a landscaper, my son's a landscaper, I work with him occasionally. It helps us recover from these harder days and harder workouts more efficiently. It helps us build muscle more efficiently. It's also very synergistic with testosterone in its ability to burn visceral fat. So as we age, the visceral fat, it carries some risk with it when we carry this visceral fat around the belly. And the Sermorelin works very synergistically with testosterone to increase the visceral fat burning. And then of course, the muscle size, stamina, our ability to tolerate harder workouts is going to be markedly improved. When you get into the gym and I've got a long day today, I'm getting ready to head over there shortly. I've got a 90-day, slog today, and Sermorelin in conjunction with testosterone can really help us sustain exercise at a high level longer as well. And again, sustain hard work for you guys that are out there slogging it out with some of these harder jobs, steel factory workers, carpenters, bricklayers, some of you guys that are just working very vigorously. It helps us tolerate and recover from those harder days, get better sleep, so when you wake up, you're more refreshed, you're ready to go, and it limits some of the joint pains. As far as side effects and risks with Sermorelin, it's relatively safe, but it needs to be evaluated first prior to proceeding. We need to make sure that there are no tumors present. That is an absolute. You cannot be on any type of growth hormone analog or peptide if there's a tumor present. Absolutely not. History of tumor is also a pretty considerable no-go. Certainly wouldn't use it in those situations either. Those are your risks right there, side effects. And I always like to talk about medicines having side effects and risks. Side effects are things that can bug us. Risks are the things that can hurt us. So if there's a tumor or previous cancer, not on the playing field. But if those things aren't present and we don't see them in labs, on the playing field for a good percentage of our guys. Now, side effects. Some of the things that we can see with it is a lot of guys will complain about vivid dreams or perhaps like nightmares. Now, what happens is a lot of guys aren't used to getting good sleep quality where we're getting into REM consistently. And if you're not getting into REM or you're not waking up remembering dreams, you're likely not getting into REM. So with Sermorelin, you will get into REM. So you're going to dreams. You're going to wake up and kind of go, oh, what was that last night? And it's not that you're having vivid dreams, you're dreaming. It's because you're getting into REM, and that's very common. Sermorelin can also increase our sensitization to, or make us more sensitive to ghrelin, which is kind of our hunger hormone. And for some of us that have high anxiety, I was 21 years Army, I've got some PTSD. I'm a highly anxious guy, I'm always on the move. And when I take Sermorelin, one of the things I notice is I'm hungry. And it doesn't happen to everybody, but for some of us, it makes us more sensitive to that hunger response and can make us a little bit more hungry. I'm also cautious to use this in men that have insulin resistance. There was a study years ago that demonstrated perhaps we have to be careful as this can promote some insulin resistance in some men with the right setups. We have to be careful in those scenarios. And this is where we should have a good evaluation just before slinging medicines at you. So if you're on testosterone replacement therapy, whether it's here or with another facility, and you're going, gosh, I'm just not seeing my results where they should be, you've got to remember, testosterone isn't the only thing to think of. As we age, there are many other things that are going to decline and begin to limit us. A peptide like a growth hormone releasing peptide like Sermorelin is wonderful. NAD is going to decline as we age. Glutathione is going to decline as we age. B12 might have difficulties with the B12 levels, absorption, methylation. So there's a lot of things to consider when we're trying to get your energy better. What kind of fuel are you putting in your body? How's your insulin resistance? We have prediabetes. And if you haven't had those things looked at and you're in another program, you're not feeling well, shame on them. We'd be happy to meet with you. 330-662-1030. You can call or text. You can go to our website, www.columbuslowt.com. You can schedule initial consultation there. We respond well to both text and phone calls. And stay tuned, more information coming.